Here is your question. Just 2 seconds left. Right. So if you have read and understood, considering a critical care scenario, kindly please tell me, how would you manage this patient?
I will manage this patient in the high dependency unit, and I will manage this patient according to the CRIS protocol
Yes.
and according to the ABC protocol. I will order the fresh labs that includes fresh full blood count, urea, creatinine, electrolytes, and assess the patient via the physical examination.
All
And
right.
also, I will
And
order the I will also order the ABGs and chest X-ray as well,
okay.
and wait for the results.
And what would you do meanwhile? Oxygen saturation is
Yes,
88% with mask and blood pressure is 80/40.
yes, madam. I will prop up the patient, and
Okay.
I will
Before
continue.
that,
Uh, I will auscultate the patient regarding any uh, physical findings in the chest, and I
okay.
will start with the IV fluids and maybe inotrop supports.
And
And if there is any finding of the fluid overload, I will give him uh, diuretics as well.
okay. How would you make sure that oxygen saturation rises because it's 88%? With the mask, what's happening?
So I think he is having some kind of hypoxia that could be secondary to, as this is the post-surgical patient, post-therapy patient, that would be due to hypervolemia, hyponatremia, or that could be due to acute myocardial infarction as well.
Okay. So what would be your provisional differential diagnosis that you'll consider?
That could be TVRP syndrome.
Yes.
That could be acute myocardial infarction. That could
Okay.
be congestive cardiac failure. It could be septic shock, and there could be effects on the anesthesia drugs as well.
Okay. How long would you wait till you'll observe the patient again?
Uh, as this is a hypertensive patient and the saturation is decreased, I
Yes.
will start managing the patient, and based on my physical findings, I would take step by step towards the management and wait for the labs.
Okay. So what are the, since this is the post-TRP patient, what are the complications that you expect to see in this patient in this situation?
Yes, madam. There could be cardiac arrhythmias due to rapid change in the sodium levels. There could be seizures, and there could be glycine toxicity.
Why do you think glycine has been used during the procedure, or why would you do it?
Because to limit the conductivity of the diathermy, the hypotonic glycine solution are used.
Can you explain the mechanism, how this syndrome occurs?
Yes, due to continuous resection of the prostatic tissue, the venous sinuses are open, and due to continuous irrigation with the hypertonic solution, the hypertonic solutions are absorbed in the venous circulation. That would lead to hypervolemia, and that would lead to dilutional hyponatremia.
Okay. Can you explain why the patient is confused and disoriented?
Yes, the patient is confused because of the hyponatremia, and that causes the cerebral edema. And the patient can be confused because of the hypoxia. And the other thing is the patient can be confused secondary to the glycine toxicity.
Okay. This low oxygen saturation, even with the mask, leads to what kind of symptoms in the patient?
The first symptom would be the confusion. The patient could be agitated, restless, and he can experience uh, acute myocardial infarction in this case of hypoxia as well.
Okay, could even also be because of pulmonary edema. Can
Yes.
you please, okay, the confusion could be because of low sodium, cause of low
Yes.
sodium. Right, you've already told me where would you involve, where would you manage this patient? Who would you involve in the management of this patient?
Uh, I would involve the nephrologist regarding the fluid management and the intensive unit registrar. And uh, once I rule out, once if there is any evidence of any cardiac involvement, I would involve the cardiologist as
Okay, right, considering the patient situation right now, what kind of fluid would you give to the patient?
well. Yes, I would recommend giving him isotonic solution that includes 0.9% sodium chloride, uh, normal saline, and we can offer him colloid as well.
Okay, how would you give the fluid?
Uh, we will give the fluid on the maintenance dose while calculating the daily maintenance fluid, and we will make sure that the sodium correction would be less than 10 millimole per day.
Okay, right. Which diuretic would you think of giving to the patient in the current scenario, and
We
why?
will administer, yes, we will administer osmotic diuretics in this case because these are the large proteins that increases the oncotic pressure in the oncotic pressure, and that will lead to water excretion.
All right. Can you give example of the osmotic diuretic that you'll give?
Menthol.
Why would you not consider giving thiazide?
Uh, uh, because thiazide diuretics acts on the distal convoluted tubules and the uh, sodium chloride channels. It will uh, not have a profound effect on the hypervolemic state. As this is the hypervolemic state, we need to get rid of the water and conserve the sodium.
Okay, but that also tries to preserve sodium from the distal convoluted tubules. Okay, can you tell me what measures can you take in order to prevent the patient undergoing all these complications?
Yes, by keeping the resection limited up
Okay,
to maximum of 40 to 50 minutes, and the
yes,
use of irrigating fluid should be very cautious.
yes,
And the height of the irrigating fluid should be less than 60 centimeter from the OT table.
yes, and
And the other thing would be to keep the surgery as short as possible.
okay. Does the giving glycerin plays any role?
Yes, ma'am. As this is the hypertonic
Um,
solution, it will lead uh, TR syndrome. So we can
yeah,
offer the patient with 0.9% sodium chloride,
yeah.
normal saline, as irrigating fluid.
One another point that you can keep that early intervention, and once you are giving regional or spinal anesthesia, so you have to keep that in your mind as well. So that good. That has gone. Right. You told me about the clinical features. I did ask you. Maybe you can tell me in one last question that syndrome is characterized by what? If you can define the TURP syndrome. So just 3 conditions I want you to mention.
Yes, ma'am. That would be hypervolemia,
Yes, please.
Hyponatremia,
Yes.
and uh, not
Osmolarity, hyposmolarity.
hyposmolarity.
Yes. Okay, good. All right. Thank you.